I'm Jeremy Fernandez. Coming up, the surge in cases in Victoria, reopening international borders, what it means for you and Australian businesses. But we begin with the resignation of the New South Wales Premier, Gladys Berejiklian, in the midst of the state's most challenging period of this pandemic, as she tries to set the template for what living with the virus looks like in the months ahead. Ms Berejiklian says she's standing down so the state government can focus on the outbreak. She made her announcement after the New South Wales corruption watchdog named the outgoing Premier as a subject of an investigation into alleged breaches of public trust.
My resignation as Premier could not occur at a worse time, but the timing is completely outside of my control, as the ICAC has chosen to take this action during the most challenging weeks of the most challenging times in the state's history. That is the ICAC's prerogative. Resigning at this time is against every instinct in my being and something which I do not want to do.
So what does this extraordinary development mean for the state's fight against the pandemic? Here's the ABC's Sarah Gerrithy.
The Premier's resignation comes at a critical time in the state's management of the COVID-19 pandemic, with New South Wales due to start opening up after a 3-month-long lockdown in just 10 days. For months, the Premier has pushed back against those within her own government who wanted to open up sooner and faster. She's tried to delicately balance the competing needs of the health system, the economy and the lives and mental health of millions of lockdown residents. Now, whether New South Wales continues to pursue that strategy will be determined by who becomes the next Premier, and they'll also have to manage significant internal tensions about where New South Wales goes from here within the coalition. One of the most talked about contenders, the Treasurer Dominic Perrottet, has been an advocate of a more aggressive opening up strategy. But the Premier has already laid out a clear plan for what happens when New South Wales reaches 70, 80 and 90% vaccination status, and it will be a big call for a new Premier to now change that. The fate of millions of people in New South Wales and what the next few months look like will depend on who the Liberal Party elects to replace Gladys Berejiklian.
Victoria's outbreak has now overtaken New South Wales, and the Andrews government there has introduced new measures to try to deal with a surge of community cases. For more on that, let's bring in Casey Briggs. Casey.
Hi, Jeremy. Well, daily cases in Victoria have now surged right up into the 4 digits, with quite a surprising spike in cases on Thursday, 1,400 of them. And the government there says a big factor behind that big spike is because of social gatherings over the long weekend just gone that coincided with the AFL Grand Final. So there's a bit of a warning, I guess, for the NRL states. New South Wales and Queensland both have cases in their communities at the moment, and both have an NRL Grand Final coming up and a long weekend coinciding with it. So a warning there about what could happen if that goes haywire. But Victoria on Friday has kind of reverted back toward the mean, but this trend line is still growing, and we're yet to see if there'll be really any kind of bigger consequences out of the spread from this day into new parts of Melbourne, the eastern and southeastern suburbs in particular. Now, we would have hoped by now that we'd actually be seeing an improvement in these case numbers. A couple of things are working against Victoria at the moment. One, this extra spread we've just seen causing some problems, but two, the vaccination levels that we're seeing in Melbourne, well, they're not optimally the vaccines haven't been optimally delivered across Melbourne in a way that helps bend this curve most efficiently, because in Hume, in Whittlesea, some of the hotspot areas of this outbreak, the double dose vaccination rates remain lower than the average across the rest of Melbourne. Now, the numbers are catching up. They're catching up quickly, but it's just going to take a bit of time for these numbers here particularly to get toward the statewide average, which currently sits at 50.6% of the 16 plus population. And so in terms of the actual statewide targets, the 70%, the 80%, when rules will start to ease, you'd expect on the current, based on how quickly we've seen doses going in to date, you'd expect Victoria would get to 70% in late October, maybe about the 27th of October, and 80% on about the 9th of November. But I actually think we'll probably see those milestones met a bit earlier than that because of a couple of decisions we've seen in Victoria this week. Primarily, the big one is reducing the interval of between 2 Pfizer doses from the 6 weeks they pushed it out to back into 3 weeks. We'll see exactly how many people take that offer up, but it should bring forward those timelines by a little bit. And the other one is the new vaccine rules for authorised workers across the entire state. So anyone who is on that workers list in Melbourne currently can't go to work without without a permit, and from a fortnight from now, they won't be able to go to work if they haven't at least had their first dose. So we'll see how much of an impact that has in actually encouraging people to get vaccinated. And Jeremy, these targets here are all based on the 16 plus population, but let's remember to also keep across what's happening with 12 to 15-year-olds, because the numbers there are growing very quickly. 37.9% of that age group across the country have had their first dose, and in New South Wales and the ACT, that number is more than 50%, extremely high and extremely fast growth in a very short time. Victoria, it's not that far behind in the high 40s. So some really good progress there, Jeremy.
Casey, thank you. James Trower is the head of epidemiological modelling at Monash University in Melbourne. Dr. Trower, there's been a staggering increase in cases in Victoria. What are the main factors here?
Well, we've seen exponential growth for several weeks now, and I guess the numbers do keep trending upwards, and we're not seeing that the vaccination rollout that we've had is enough to bring those cases stable and see them plateau and then begin to drive them back down, as we've begun to see in Sydney. Hopefully that will happen very soon as we reach the levels of vaccine rollout that they've achieved in Sydney. But yeah, I guess it is still very concerning, and with case numbers this high, we'll see a lot of strain on the hospital system very soon.
I want to come back to that issue of vaccinations in a moment, but on these case numbers, is this a sign of lockdown fatigue, that goodwill is now thin, or is there something else going on?
Well, the rate of increase has been steady, I think, for several weeks now. I think now that we've hit 1,000, people are getting very concerned. And there are other factors at play, of course, as well, such as contact tracing is just more difficult when you have that volume of cases, and so it's harder to keep control. So we're in this really difficult transition period where we're changing over from the COVID zero approach over to relying on vaccination. And I guess at the moment we can't rely on vaccination, we just don't have the coverage, but hopefully that will come really soon.
So in Victoria, of those people in hospital, 3/4 haven't been vaccinated, 5% have had 2 doses. So this is overwhelmingly now a disease of the unvaccinated. Where do you place vaccination in the range of strategies that Victoria has in front of it right now?
Well, it's absolutely critical. That's what we will be relying on. And I think we need to, in the coming months, move away from a lot of the strategies that we previously used to control COVID, because they're just obviously not sustainable in the longer term. And clearly the top one is lockdowns. We need to stop having lockdowns, and vaccination is clearly the pathway towards achieving that.
Premier Daniel Andrews is leaving open the option of revising Victoria's roadmap out. How do you see that? It doesn't really offer a lot of certainty, does it?
I think you have to be ready to revise this strategy, because if we get to the point, I mean, we don't really know what is going to happen. The case numbers next week, we're trying to predict them. You know, a range of modelers are engaged in trying to work out where we'll be 2 weeks from now, but it is just difficult to work out exactly what's going to happen. And if we get to the point where our health system is overwhelmed, where people just can't access the care that they need, and that's basic supportive care as much as anything else, just oxygen and ventilators. If we get to that point, we have to be ready to tighten our restrictions and go back. But hopefully we won't need that. I think, you know, vaccination we should be able to rely on, but we do just have to see how things pan out.
Things are starting to open up in Victoria. Is it too soon, given where vaccination coverage is right now?
I think we should be looking towards it. I mean, we need to get as many people vaccinated before their first exposure as possible. And I think we should be able to achieve that, given the trajectory we're heading in, although the case numbers over the last couple of days have been really concerning. So we do have to be careful, but I think in the coming weeks, we should be able to get away from lockdown as we see those really high rates of coverage come through.
How bad is it going to get?
It's really hard to predict. And I think I should disclose that I'm working with the State Health Department to try to answer some of these questions. And clearly the Burnett modelling has been particularly prominent in trying to work out where the numbers are heading, and it's dependent on a lot of things that are particularly uncertain. And I think one of the really key things is how much vaccination, and the vaccines that we have in particular, including AstraZeneca and Pfizer, as the 2 main vaccines that have been rolled out, how much they protect against onward transmission. And we know that to some extent, but we know it particularly for 2 doses, and we've got a lot of people who are 1 dosed at the moment. So it's those uncertainties make it really hard to predict where we're going.
Dr. James Trower, thanks for your time.
My pleasure.
Billions of dollars worth of assistance packages will come to an end, with the federal government announcing this week it'll soon wind up support payments for COVID-affected businesses. The payments will stop when the 80% vaccination target is reached. Felicity Emmett is a senior economist at ANZ, and Alexei Boyd is the CEO of the Council of Small Business Organisations. Welcome to you both. Alexei Boyd, I'll begin with you. All things considered, is it time that this support was withdrawn?
Well, look, I think small businesses understand there's not an unending tap, and it's never an intention for small businesses to be propped up by government support forever. So it's really important that we work with small businesses to make sure there's a step-down approach to the government support in whatever form that's coming, and also to make sure that the continued support is tailored for those who really need it.
Felicity Emmett, there are some very distinct signs, aren't there, that this will affect different sectors differently. How are you seeing that playing out in the next few months?
Yes, will be the crucial point here, that businesses that are still subject to social distancing requirements, hospitality, arts and recreation, may still be struggling, and they're not going to be working at capacity. And so those businesses, I think, will do it tough if that support is fully withdrawn. But it is going to be gradual. The New South Wales government has said they will maintain the support till the end of November. And I think we can be quite encouraged by that pattern of the last year, and the fact that households are in very good shape. They have quite a lot of savings. Businesses too have been well supported through the lockdowns at an aggregate level. And so many of them are in good shape and are ready for a very strong rebound. So I think we can be confident that as restrictions lift, that activity will rebound quite quickly.
Alexei Boyd, when you hear assessments like that, how much confidence does it give small business? And do you have a sense of which sectors will recover sooner than others?
Well, certainly we're really hoping that that bounce back does happen and that consumers get out there and start spending with small businesses again. But there are other factors at play here that small businesses are concerned about. Obviously, the concern about being snapped back into a lockdown again when a COVID case enters the building. And it means that you don't have the confidence of being able to reopen, knowing that that's a long-term strategy. You could be locked down at any time. Similarly, we do hear from our members that there's a lot of problems with the shortages of skilled and unskilled labour, and we're really looking forward to when we can have those migration levels back up to normal and replenish the stock that we've lost. Small businesses are really struggling to find the labour that they need for the openings that are coming only around the corner, and are concerned about what happens in the next 6 to 12 months with those labour shortages. But there are going to be some businesses that have succeeded quite well out of this, and others that are doing it really tough, particularly in tourism and accommodation. And that obviously is going to be impacted by borders opening up as well. So we'll wait and see and look forward to what's happening for small business. But there is still a lot of concern out there.
It sounds like you see the need for industry-specific assistance from the government going down the track. Is that right?
Absolutely. We're looking forward to working with the government for them to hear what industries are really continue to suffer. And obviously, consumer confidence is going to change what the patterns of spending is going to be, and borders opening up and the movement of people between states. That's all going to impact the different industries and how they're going to be affected. So we look forward to having that conversation continue. It's not just a matter of an opening date, but it's going to be a gradual conversation as to which industries are doing well and those that will continue to be affected.
Felicity Emmett, we've spent so many years prior to this pandemic hearing about the distaste of debt and deficit. Are you concerned about national debt? Where does the average Australian think about that in terms of the commitment, financial commitment we've made to dealing with this pandemic?
Over time, this spending will help generate a stronger economy. Next year should be a very strong year for the economy, and that will help us to repay that debt. You know, we have to think about public debt a little bit differently to the way that we think about household debt. And one of the easiest ways for the government to pay that back is to grow the economy. And I think that is what will happen once vaccination rates are up and the economy opens. There hopefully will not be that need for that extra spending, but there will be tough decisions for the government to make over time around their spending commitments and taxes.
Felicity Emmett, Alexei Boyd, terrific to have you both with us. Thank you so much.
Thanks, Jeremy.
Thank you.
And that is the show for this week. You can catch up with the show anytime on ABC iView. From all of us, thanks for your company. Bye for now.